Welcome back to Jersey Matters. Recently, we've had another outbreak of measles in New Jersey concerning the CDC, state health officials, and pediatricians across the state who are pushing for all children to get vaccinated. Our Kolodziej spoke with a pediatrician about just that.
Thank you, Larry. That measles outbreak in New York City has certainly put the national spotlight on vaccinations. But experts here in New Jersey have been fighting for more than a decade to stop some misconceptions and to get the word out about why it's so crucial for you to get your children vaccinated.
It's a shame that you could have an outbreak of a disease that's preventable, that's easily preventable. In my logic, and not even as a physician, before I was a physician, if you could prevent getting something, you did.
Peter Wenger is the chair of the New Jersey Immunization Network. He can't fathom why anyone would refuse to get their child vaccinated. That's why the network started back in 2007. Right after celebrities such as Jenny McCarthy and Jim Carrey started a crusade saying some vaccines might cause autism.
Without a doubt in my mind, I believe vaccinations triggered Evan's autism.
The doctor she always quoted turned out to be a fraud and lost his medical license. But McCarthy's campaign caused long-term damage that the Immunization Network still fights. People are also against vaccines for religious reasons, philosophical differences, and low-income parents concerned about transportation and money.
Cost is always, having to do the co-pays and work with that is absolutely part of that consideration. Having docs that have the inventory of the vaccine, timing-wise, is a big part of that. So they all play a role in this, and misinformation is being afraid.
Despite those concerns, Weinstein says the numbers in New Jersey schools are pretty good, but there's room for improvement. 95% of all students meet the full requirements for vaccinations, but 490 schools have immunization rates below the required level. 13,000 students are missing vaccines, and Dr. Wenger says that's still too many.
Measles is very, very contagious, so you need a very high rate of immunization, herd immunity within the community, to prevent any outbreaks. If you fall below that, you risk outbreaks. And it can be a serious disease. So why have it if you could eliminate, it's a real public health conundrum. Why, if you can prevent it, why is it here?
Measles were basically eliminated in 2000 in the U.S., so to see this disease come back is shocking for some people. Now, these numbers don't even include younger children who usually don't get the second shot until they're 5. So they're the ones who are most susceptible if a sibling is exposed at school, and that's what's so frustrating.
They don't have a voice. They don't have an option. We have to do what's right for them. And I know we all think that we are, including people that are resistant, that's first and foremost. But I think something gets lost in the translation, and we need to step up and make sure that the kids are taken care of.
Right now, there's a bill in the General Assembly that would eliminate the religious exemption for vaccinations. That means if it passes, every child would have to have their shots before going to school. No word yet on when that would come up for a vote. Reporting from East Windsor, I'm Kolodziej for Jersey Matters.